Bismillahirrahmanirrahim. I am Professor Dr. Sayyid Amir Gilani, and we are having a webinar on ABC of Doppler ultrasound. So let's start. The Doppler effect or Doppler shift, or simply what we call Doppler, is the change in frequency of a wave in relation to an observer who is moving relative to the wave source. It is named after one of the Austrian scientists who was a physicist, and his name was Christian Andreas Doppler. He described the phenomena of Doppler shift in 1842, and he died on 17th March 1853 at the age of 49 in Austria. He used to work in the Imperial Royal Polytechnic Institute in Prague, which is nowadays a city of Czech Republic. His fellow B. Bellet described a theory on horn players on a train, which confirmed the concept of Doppler shift, which was given by Christian Andreas Doppler in 1841. The paper he wrote was about the colored light of stars, in which he described that when we look at the stars which are moving, we can get a halo around the stars that can give us predominantly red color. That means it is moving towards us. And if it gives blue color, it is moving away from us. And if we don't get any colors, it means we are at 90 degrees from that star, and that point at which that star comes at 90 degrees to us changes the color, and that change in color is the Doppler shift. He described it as a shift. Then after 4 years, B. Bellet confirmed it. He described the theory on horn players on a moving train. He said that if somebody is standing at a platform and a train is moving towards him, and the horn of train is on, and when it is moving towards, as it is approaches the standing person at the platform, the sound will keep on increasing. And when train passes through the stationary person, the sound will start decreasing. And he said that there will be a fraction of a second when the train on the source of that sound, which creating horn sound in a train, is at 90 degrees to the ears of the person who is stationary at a platform, he will not be able to hear. And when the train was approaching towards that person, stationary person, sound was increasing, and when it passed through that person, it started decreasing. He said this is the shift from positive sound to the negative sound, increasing sound to the decreasing sound. That fraction of second was Doppler shift. We can assess the personality, the thoughts of a person from his sayings. So the Christian Andres Doppler said, the most rewarding researches are those which are a joy to the thinker and at the same time are of benefit to mankind. The color Doppler uses standard ultrasound methods to make a picture of a blood vessel. A computer changes the Doppler sounds into colors that are overlaid on the image of the blood vessel. These colors show the speed and direction of blood flow through a vessel, whereas power Doppler is a special type of color Doppler which is uh, supposed to have more power to get better colors in the vessel. In the beginning, when color Dopplers were introduced in 1980s, the machines had two monitors, one showing just grayscale and other monitor showing grayscale with color. Why? The reason is that before introducing the color Doppler machines, the manufacturers had grayscale machines, and all the sonographers, radiologists, or those who were performing ultrasound, the physicians or gynecologists, their eyes were used to the grayscale images on ultrasound. So, in order to make it easier for them, the monitor was divided into two parts, or we can say having two monitors joined together. One was showing just grayscale and another was showing blood vessels with colors. That was used for some time, and then the color Dopplers they came with a single monitor having both things, grayscale as well as color Doppler, but their knobs were very complicated. The question arises that what is this test? How did Doppler test the Doppler effect? A Doppler radar uses reflected microwaves to determine the speed of the distance of that distant moving objects. It does this by sending out waves with a particular frequency and then analyzing the reflected waves for frequency changes. This is how the color Doppler machine works. Then came the simpler machines with grayscale and color Doppler. And we know that the most ultrasound machines have three main components: a pulsar, which is transmitter, which generates pulsed echoes in form of brief bursts, a transducer, which converts electrical energy to acoustic pulse, which is the sound energy, and vice versa. So it generates acoustic pulses which travels in the body and then rebound sounds comes in the form of echoes and are recaptured by the transducers. A receiver which detects, compresses, and amplifies signals returning to transducer is the third part. So transmitter, receiver are very important components, and then is the transducer. Doppler ultrasound provides us the information about presence or absence of flow, direction of flow, speed of flow, and character of flow. The Doppler principle says that when sound is reflected from a moving object, frequency of the reflected waves is different than frequency of incident waves. This is the Doppler shift equation which is used. Fd is equal to 2 FOV cos theta divided by C. Fd is Doppler shifted frequency, what we measure. V is velocity of RBC is what we want to know. And FO is transducer frequency. Cos theta is cosine angle of the ultrasound beam. C is the velocity of the sound in body tissues. So here is the beam, the sounds are traveling, and a blood vessel has got RBCs with a specific velocity. They are moving in this direction in this slide, and then the sound strikes the moving RBCs and is reflected back. And this is the angle between the center of the stream of blood vessel and then is the center of the transducer. So transmitted sound and received sound. Relationship derived from this equation are Fd, which is the Doppler shifted frequency, is directly proportional to the transducer frequency, which is Fo. For instance, if you look at the incident frequency, if it is 2, the flow speed is 50, the reflected frequency will be more than the incident frequency, and there will be a Doppler shift of 1.3 kilohertz. If we keep the flow speed constant and increase the incident frequency, the reflected sound will also increase, thus increasing the Doppler shift. Whereas if we increase the flow speed at incident frequency, which is 2, the reflected frequency here you can see is almost same, but the Doppler shift is increased. Similarly, if we increase both, we will have similar reflected frequency as it was at 50 centimeter per second speed, but the Doppler shift is increased. It means the Doppler shift is directly proportional to the flow speed and incident frequency. And the Doppler effect or the Doppler shift is the change of frequency of a wave in relation to observer who is moving relative to the wave source. There are three main types of Doppler: continuous wave Doppler, pulse wave Doppler, and color flow Doppler. Similarly, the blood flow information is obtained in three different ways: audible sounds, spectral display, and color flow image. There is difference between continuous wave Doppler and pulse wave Doppler. Pulse wave transducer is a transducer which is emitting sound waves in the form of pulses. They are sending, then receiving. So they are sending in pulses and receiving in pulses. Whereas a continuous wave Doppler is having a transducer which actually the case contains two transducers, two emitters. They are continuously sending and receiving. There is no pulse. Continuous wave Doppler is used in assessing the moving objects like in adult or pediatric or fetal echocardiography, whereas pulse wave Doppler is the color Doppler which is used to assess other vessels like the peripheral vessels, abdominal vessels, or any vessels in gynae and obstetrics or musculoskeletal. The flow pattern, we must keep in mind that like all fluids, blood flow from a high pressure area to a region with lower pressure. Blood flow in the same direction as the decreasing pressure gradient, arteries to capillaries and capillaries to veins. The rate or velocity of blood flow varies inversely with the total cross section of the blood flow vessel. So this is how the hemodynamics takes place. The blood is moving in one direction. The sound waves they strike and come back. So the hemodynamics are the dynamics of blood flow. The circulatory system is controlled by hemostatic mechanisms of autoregulation, just as the hydraulic circuits are controlled by control system. The hemodynamic response continuously monitors and adjusts the conditions in the body and its movements. The arterial blood flow pattern is normally is laminar flow. It is called plug flow when it is entering a vessel, when the blood is entering. So the flow pattern of blood vessels at the beginning of the vessel is called plug flow, and then it is called parabolic flow. So laminar flow is of two types: plug flow at the beginning of the vessel and parabolic flow at rest of the vessel. The abnormal blood flows are again of two types: disturbed laminar flow, or called disturbed flow, and turbulent flow. Disturbed flow is seen when there is bifurcation of a vessel or there is stenosis, and turbulent flow is seen just after the disturbed flow. So as there will be narrowing in the disturbed flow, the velocities will increase, the resistance will increase. Whereas in turbulent flow, after a stenosed area, the blood cells, the RBCs, will go in haphazard directions, and that can cause turbulence. So flow can be of various types. The laminar flow, which is of two types, plug flow and parabolic flow, it is straight normal flow in an artery. Disturbed flow is abnormal flow at stenosis or bifurcation of the vessels. Turbulent flow is the flow which is due to turbulence, and it is seen just after the stenosis or disturbed flow. Pulsatile flow is normal flow It can be monophasic, biphasic, or triphasic in the vessels, in the arteries. But if it is seen in veins, it will be abnormal, except in hepatic vein, which is lying close to the heart. This is laminar flow. In the beginning, here is the blood flow, and then laminar flow, which is parabolic flow. Blood vessel is three-dimensional. This is how it appears. Blood vessel wall, then are the zones, the central zone, and then are other zones. As we go outward towards the wall of the vessel, the resistance will increase, so velocity will decrease. According to the spectral Doppler pattern, there are two main types of laminar flow, and here is the baseline. And in laminar flow, here we can see a biphasic flow of a vessel, and it is low resistance because the diastolic is lying above the baseline. Then we can have another type of laminar flow. Here we can see it is an artery having triphasic flow, first, second, and third phase, systolic, diastolic, and we have another small systolic. So it is triphasic flow showing high resistance vessels usually seen in peripheral arteries. As we discuss, the laminar flow occurs in normal arteries, large and small, flow in layers. That's why it is called laminae, laminar flow in layers. Each layer sliding over the adjacent layer. So it is like layers. Slowest at the boundary because of resistance, fastest in the center. That's why we try to take a sample from the center. The laminar flow occurs in normal arteries, flow in layers, each layer sliding over the adjacent layer, slowest at the boundary, fastest in the center. And the velocity profile is that the change in velocity across the lumen of the artery is called the velocity profile. The laminar flow, as I discussed earlier, is of two types, plug flow and parabolic flow. So the change in velocity profile with distance along the vessel is from a blunt of a parabolic. This is how it appears, a laminar flow in an artery on color Doppler. Plug flow, which is also a blunt flow seen at the entry of the blood at the beginning of the vessel, seen in large arteries, occurs during systole. There will be large lumen, decreased frictional forces from wall. Majority of the laminae flow at a similar speed, and there will be systolic window like this. This is the systolic window. The parabolic flow is seen in smaller arteries more commonly. Smaller lumen, increased effect of frictional forces from wall, fastest laminae are in the center of the vessel and adjacent to vessel wall move more slowly, and there will be systolic window. This is the small systolic window. In fluid mechanics, plug flow is a simple model of the velocity profile of a fluid flowing in a pipe. In plug flow, the velocity of the fluid is assumed to be constant across any cross-sectional area of the pipe perpendicular to the axis of the pipe. So if this is a pipe, this is how it is moving. The parabolic flow, this is an example how it goes in larger vessels. So parabolic will be like this. This is the cut section. This is how it will be in the layers. So the maximum velocity will be in the center of the vessel. Disturbed flow is seen at stenosis. It occurs in the vascular system in a number of conditions which include the flow disturbance that naturally occurs in certain regions such as branch points and curvatures of large arteries and the aortic and venous valves sinuses. Flow disturbance generated in arteries through surgical intervention. The disturbed laminar flow seen at stenosis, vessel bifurcation, vessel contour change like in curves caused by high peak velocities at curving branches and divergence, often causes bruit in large arteries with mild to moderate degree of atherosclerosis due to atherosclerotic plaques. The turbulent flow, you might have heard the word turbulence while traveling in a plane. The turbulent flow means it is a type of fluid, gas, or liquid flow in which the fluid undergoes irregular fluctuations or mixing in contrast to laminar flow. So there will be mixing and fluctuation in the flow in which the fluid moves in smooth paths or layers. So in turbulent flow, the speed of the fluid at a point is continuously undergoing changes in both magnitude and direction. So it is haphazard movement in different directions. In turbulence, the minimum and maximum velocities increase. Here is the laminar flow. Then comes the stenosis, where we will have disturbed flow followed by turbulent flow, where the RBCs are going in different directions haphazardly. Turbulent flow is abnormal type of flow and non-laminar. It's not disturbed flow but spherically disturbed flow. There is no layering, no laminae. It is a kind of chaotic flow in which blood flows in more than one direction, or we can say in all directions. Not a normal feature of blood flow in any artery, and occurs when blood flow at extremely high velocities, such as those occurring in the region of the high grade stenosis, often seen immediately after significant stenosis. Sorry. The significant pressure gradients are present and we can get bruit and thrill in the vessel. Then comes the velocities. For instance, this is the baseline, a biphasic flow, low resistance, and this is the lowest velocity and highest velocity. The difference between these two velocities is called the broadening of the spectrum. This is broadening, increasing. It means the difference between the highest velocities and the lowest velocities at that specific cardiac cycle is increasing. In spectral Doppler, this is how we usually get a biphasic flow. early systolic, peak systolic, and diastolic. And this is the upper and lower part indicating the higher velocity and lower velocity. Then we have the spectral window. Black area is the spectral window. So whenever there is stenosis, the spectrum will be broadened. But normally we can get this broadening also at bifurcation of the vessel. So we have to look at the difference, either it is stenosis or our sample volume is at bifurcation of the vessel. So when there is stenosis or there is disturbed flow, the distance between the highest velocity and lower velocity will increase. That will result in spectral broadening. And then we can see when it comes to the normal, that spectral broadening has come to the normal size. So this is the peak systolic velocity, early systolic. There is the end diastolic, early diastolic. Here is the end systolic and early diastolic are at the same point. This is the spectral window, the black area, and the distance between the outer and inner layer of the spectrum is the spectral width. And when the width is increasing, that means there is spectral broadening due to bifurcation of the vessel in normal cases or disturbed flow in stenosis in abnormal cases. Spectral window is another important thing to be discussed. The spectral window is a clear black zone, this area, between the spectral line and the baseline. Widening of the spectral line and filling of the spectral window is called spectral broadening. It is normally seen in the presence of the high velocity at the branches of the vessel or in small diameter vessels where our sample volume cursor is like here. We can see it is covering 100% of the vessel. We cannot decrease it because the vessel is small. So it will cover everything and there will be broadening of the spectrum and filling of the window. That indicates that either our sample volume, this area which is the window, is maximum is equal to the blood vessel width. That's why it is filled. Similarly, if we have stenosis, after stenosis we can get turbulence. In turbulence we will have broadening of the spectrum and filling of the vessel both together. So normal, and after the stenosis there is normal. Here is the normal, then comes stenosis. In stenosis we have disturbed flow in which there was just broadening of the spectrum, followed by turbulence in which there is broadening as well as there is filling. So this type of spectrum can be seen in two cases. Normal, if it is normal, it can be seen in small vessels when our sample area is greater or equal to the width of the or the lumen of the vessel. Secondly, it can be abnormal when there is turbulence. So we keep in mind whenever there is disturbed flow, there will be broadening of the spectrum, and when there is turbulence, there will be broadening of the spectrum along with filling of the window. Then comes the spectral Doppler on colors. How we assess, we usually assign red color to the positive Doppler and negative is assigned as blue. So anything moving towards the transducer will be red and moving away from the transducer is blue, which is moving towards the transducer is positive and the one which is moving away is negative. But at 90 degrees to the transducer is called the Doppler shift when the positive is shifting into negative. Here we can see it is umbilical artery, but we are getting it below the baseline. It means the transducer's head and tail are upside down. Biphasic flow, low resistance flow in uterine artery, the systole and diastole. And this is how a vein appears, mild phasicity, which is usually normal, and another venous spectrum. Then is angle of insonation, which is important. Angle of insonation is, we can define it as the angle of the ultrasound beam relative to the tissue or organ of interest. The strongest echoes are produced when the angle of incidence approaches the angle of reflection. So this is the angle of incidence, blood is moving, and angle of reflection. This is the angle between incident and reflection, reflected sound waves. That is called isonation angle. Isonation angles can be of 90 degrees. It can be less than 90 degrees, which shows weak echoes. When it goes above 90 degrees, it gives us again weak echoes, but it will be having strong echoes when it is at 90 degrees. This is how we take the sample volume. These two lines are used for getting the sample. That must be one third or 40% of the vessel lumen, but it depends how big is the vessel. In small vessels, sometimes the minimum we have will be covering whole of the lumen. This is how we decrease or increase. Wall filters, whenever the sound waves are traveling through the vessel, we need to have information from the lumen of the vessel. But as the sound waves are striking the vessel, they also strike the walls, the interior and posterior walls of the vessel. So in order to get rid of the signals which are coming from the walls, from the surrounding tissues, to have better signals from the lumen of the vessel, from the bloodstream, we use wall filters. The movement from walls and adjacent tissues produce low frequency shifts that can disturb the results. So, the wall filter in ultrasound is a way of filtering out low or high frequency Doppler signals in clinical ultrasound. It is usually used to filter out very low frequencies that may add noise to a spectral Doppler waveform. But if we set the wall filter too high, it will also remove the wanted shifts. So we have to keep it appropriate. Here we can see the appropriate is 150 Hz in this condition. We need to remove these red ones. which will bring information from the wall. A wall filter of 200 Hz will remove all shifts. Then is another important thing, aliasing. Aliasing is the mixing of color. We can use this term on color Doppler as well as spectral Doppler. Now the question arises, what is aliasing in Doppler ultrasound? It is a phenomena inherent to Doppler modalities which utilize intermittent sampling, in which an insufficient sampling rate results in an ability to record direction and velocity accurately. So here you can see this is mixing of color. That means our settings are not appropriate or there is high velocity flow. In spectral lasing, there will be apparent change in the direction of blood flow. A part of it will be coming below the baseline on the other side of the baseline. This is seen in high velocity vessels. So we use Nyquist limit, which is half of the PRF. PRF is pulse repetition frequency. We take it to the half. When we take it to the half, we will be able to see the spectral properly. Here it was a lasing. This is normal after adjusting the PRF. These are the techniques used to minimize lasing by several ways. They include increasing the scale, shifting the baseline, increasing the Doppler angle, decreasing the operating frequency, and switching to color Doppler. Types of flow and resistance to flow. This is the baseline, and we have systolic and diastolic. We can see there are three waves formed: the first phase, second phase, and third phase. So it is triphasic high resistance flow, which is usually seen in peripheral vessels of the limbs. This is high resistance triphasic. Here you can see the triphasic flow. This is again triphasic, one phase, second and third. High resistance triphasic flow. The external iliac. Then comes low resistance flow. This is biphasic. The diastole is above the baseline. So here it is, biphasic. Another vessel, abdominal vessel showing biphasic flow, low resistance. Carotid are also biphasic. If you look at the Doppler shift again, this is towards the transducer, away from the transducer at 90 degrees is the Doppler shift. We will not be able to get colors at Doppler shift at 90 degrees. So the negative is blue, which is below the baseline. Positive is red, which is towards the transducer. So B is the brightness mode, M is the motion mode, Doppler, and then is the color. Here we can see this is negative Doppler shift, whereas this is positive Doppler shift. And positive Doppler shift with negative Doppler shift, this is actually the Doppler shift at 90 degrees, where we are missing the colors. But if we use power Doppler, it is not angle dependent, so we will get continuous flow. We can use different measurements like for RI, resistive index, systolic minus diastolic divided by systolic. So this is the systolic and diastolic. This is how we measure. In order to measure the acceleration time, we draw a line at the from the baseline to the center of the peak systolic velocity, and then we measure this area from the early systolic and to the base of this line. That will be the acceleration time, the time which was taken by the spectrum to go to its peak to get it accelerated. This is how we measure using that equation. Then is the mean velocity. It is the PI, pulsatility index, A minus B divided by mean. So we take A, which is systolic, B is diastolic, and then mean of two means, A plus B divided by 2 will be the mean. The normal umbilical artery flow is low resistance flow present in systole and diastole. No reversal of flow in diastole, and sawtooth appearance is seen. This is the umbilical artery and umbilical vein. We measure HD ratio, which is the ratio between systolic and diastolic. It is also called AB ratio. The AB ratio means peak systolic velocity divided by end diastolic velocity, useful in assessment of fetoplacental circulation. This is one of the spectrum, sawtooth appearance above the baseline. Here is the vein. Umbilical artery is biphasic. There is window filling because the lumen is very small, the vessel is very small. This is single systolic, diastolic is absent, which shows placental insufficiency in this pregnancy. It is appearing monophasic. The power Doppler is not angle dependent. There are limitations of the color flow imaging, like it is angle dependent, there will be aliasing, unable to display entire Doppler spectrum, and artifacts they cause noise. That's why we go to power Doppler. The power Doppler is less angle dependent, no aliasing, noise, a homogeneous background color, and increased sensitivity to flow detection is seen. With this, we finish these 105 slides for basics of color Doppler, the ABCs or ABC of color Doppler. Afro-Asian Institute is also offering diplomas and training courses which are online and on campus, which varies from 1 month to 1 year. We can have 1 month, 3 month, 6 month, and 1 year diplomas. You can contact to the given numbers, and you can visit our website aims.edu.pk, and you can contact on email also. We have a YouTube channel where we usually put these recorded lectures. Thank you very much.